go into hospice at his home in Georgia. He made the decision after a series of short hospital stays, and he has been treated for a number of cancers over the years. He had a brain tumor. I think he had liver cancer and that type of stuff.
And it metastasized.
Hmm.
So it's just gotten to a point at this age, and the outlook was bleak, I suppose, and he's just decided to go home. And I think we probably would all make that decision.
Yeah, he's 98 years old. Elise
Yeah.
Power is the Jewish Hospice Community Liaison for Faith Presbyterian Hospice in Dallas, and she joins us this morning with more insight. Good morning, Elise.
Good morning, Amy. How are you?
Good. Thanks for joining us. So, can you tell us what kind of care the former president may be undergoing at his home right now?
Certainly. He's what they have said, and they have announced that he has chosen to go into hospice care at home. And when people elect hospice care, they're really saying that, I want comfort. I still want to have anything that will make me comfortable and allow me to have my last wishes with my family, but not to go back and forth to the hospital, which is so traumatic. And this way he can have his family gets extra services with the staffing, with social worker, if he wants to take a family picture with the family, whatever last wishes he's able to do. And hopefully with having hospice care at home, it can extend his comfort and quality of life. We don't look at quantity, we look at the quality when we go into hospice, which is palliative care, which again we treat aggressively with pain management. And that's not to say that we're stopping all medical. If he was to develop an infection, and many times patients do because they're sedentary, we would treat the infection as long as that is something that the family wanted to do.
Can
So
you
I
tell
think
us?
it's a very wide. Go ahead.
No. Go ahead. You finish your thought there.
No, I think it's wonderful that they have announced it because I remember a couple of years ago with Barbara Bush, and they just said she was no longer going to the hospital, and they never used the word hospice. So I think as an organization, as the National Hospice and Palliative Care Organization, has made advances in the industry in educating patients and families and physicians. And in fact, they even made a statement saying that his end-of-life journey should be full of love, generosity, and grace as he lives the end of his life.
Elise, that's that you just took me right where I was about to go, and that is have you explain a little bit about the philosophies of hospice care and palliative care and what they mean.
Well, great. And with hospice is palliative care, but people can also choose palliative care when they don't have a terminal diagnosis of 6 months or less to live. Under Medicare guidelines, hospice, anybody that's eligible for hospice, when a doctor writes an order, that their life prognosis is typically 6 months or less. But now you can have palliative care if you're still rehabbing and your diagnosis extends more than 6 months. So hospice is really, it's more emotional. It's you have the social worker, you have the chaplain and or rabbi, the nurse. So you have the extension of a team working with the patient and the family for symptom relief, helping making important end-of-life decisions. Many people haven't talked about their funerals or planning, and that's another topic we could have another time, is having the conversation. And it looks like President Jimmy Carter did have the conversation with his family, and they went with his wishes.
In terms of hospice, when you hear people going into hospice, a lot of times people think, they're going to pass away in the next day or two. But that's not the truth. Some people are in hospice for extended periods of time, correct?
Correct. To elect hospice, the patient's prognosis must be 6 months or less with a doctor's order. However, there are many, and the reason people think you go into hospice and you die, or you go on morphine and you die, is because people go into it so late in their disease process. So when people elect it sooner and can have the comfort and the quality with their family, it's a much better outcome, even though the outcome is going to be that they're going to pass away. But you're right. Nationally, people don't elect hospice soon enough because they haven't had the conversation. They don't want to accept the diagnosis. They haven't had a conversation with the physician. It's a very difficult decision to make and a very difficult conversation to have, but I think it's very important.
How do you have the conversation with someone who may elect down the road to go into hospice?
That's a very good question, Amy. Many times we have meetings throughout different organizations, and we talk to people about having a conversation. And, you can have it at Thanksgiving when the family is all together and people say, how can I have that conversation at Thanksgiving? It should be joyful. My kids are away at college. They're going to come home, and I'm going to tell them what my wishes are. And I'm going to say yes, because it's actually, it gives, with my father, I gave him the gift of hospice by telling him, Dad, you can no longer do rehab. It's time for hospice. And as soon as I said that, his mind changed. He said, okay, Lise, this is what I want to do. So he gave me the gift by telling me exactly what he wanted, and I was able to give him that gift. And that's how I look at it with families. It doesn't have to be Thanksgiving. It would be nicer to have it in person versus having it over the phone. But we always say it's never too soon until it's too late. Because just look at Bruce Willis right now with his diagnosis with dementia. Does his family know what he wants to do, where he wants to be? And hospice is a service. It's not a setting. So therefore, you can have it at home. Most people do elect to have it at home versus having it in a facility, or you could have it in an inpatient unit. However, being at home with your family, whatever that means to you, as far as having your family around, if you have a dog or a cat, grandchildren, it's just so important to be know your family's wishes and be able to carry them out.
So when a person chooses to go into hospice care, is that actually making a decision to quit all medical attempts to extend life or cure a condition?
Well, that's a good question. We don't want to extend and we don't cure, but we do, and we don't prolong life. But what we do is treat the symptoms. So anybody with a terminal diagnosis and anybody going to electing hospice, we want to make them comfortable. So therefore, what does comfort mean? Does it mean that we medications for pain management? Every diagnosis has a different medication profile, and the medical director of the hospice is the one that gives the orders as to what medication they should have. So if somebody does develop, like I said, an infection or pneumonia, we would treat that with antibiotics. We don't just stop. It doesn't stop all medical interventions. Whatever is appropriate for that person and their diagnosis to make them comfortable.
A lot of people may think that this is very expensive because you have all these people coming into your home and caring for your loved one. Does it cost the family anything at all?
That's a good question. So patients that are at home, they don't have the room and board that people that in a facility would have. If you're in a facility, you are responsible for the room and board. What hospice does cover, it does cover all of anything that is related to the hospice diagnosis as far as medications. Also the durable medical equipment. If it's a hospital bed, if it's a mattress, it's wheelchair, all of the durable medical equipment, the medications, and also any of the medical supplies that they would need. So it's not expensive. It's actually covering the medications that are related to the hospice diagnosis. And it also covers all the services, which is of the nurse coming out, of the social worker, the chaplain and our rabbi, the certified nurse's aide for the bathing. But hospice is not 24-hour care as far as caregivers. That would be private. And hospice is covered under Medicare for people that are over 65, and it is also covered under insurance for those that have insurance.
Elise, thank you very much for
Elise.
your time. You've given us a lot of great information. I'm sure a lot of people just didn't have. Thank you.
Thank you for the honor, and especially today being President's Day.
That's right. All right, Elise Power with the Jewish Hospice Community. She's a liaison for Faith Presbyterian Hospice in Dallas.